I am back with Dr. Damion Martins of Atlantic Health, home of Atlantic Sports Health. Damion, thanks so much for joining me here today, and so excited to be talking about such cutting edge. And you know what I really enjoy when I converse with you on and off camera, more off camera, because we're sharing so much best practices, and you are probably, of all the people I know in this industry, and I know a lot of people around the world when it comes to performance and medicine, you are definitely the most cutting edge, up to date on the most latest scientific research. And we just talked about a study that's less than a week old about calcium, how it doesn't play as big of a role as we once thought, in terms of bone health.
It's true, Bill. I think it's very hard to be in this space if you're not doing research yourself and you're not educating the doctors of the future. So, we here at Atlantic Sports Health, we take it seriously. We've been lucky enough to develop one of the largest programs in the state and one of the largest education programs in the country. So I take the job seriously, and we got to stay on top of the latest research to be able to provide the best care to our community.
Yeah, well, I fly around the country, literally around the world. I mean, we have locations in China now, Saudi Arabia, and we're in 32 different states. We're involved in a lot of different hospital systems around the country, and I got to tell you, you do special things here at Atlantic Health. The way you run education every Monday, open to the public, and it's filled with therapists from all different organizations, not just from Atlantic Health. The way you guys just outpour the information of cutting-edge research and bringing in guest speakers, orthopedic surgeons, and just sharing best practices is very unique. I don't necessarily see this being done at the level the way Atlantic Health does it. And I know you're the architect to a lot of this, and I really commend you. And we're so honored and privileged for Parisi to be involved with Atlantic Sports Health and Atlantic Health in terms of what you do and staying so cutting edge. Speaking of that, there's so many kids nowadays getting injured, overuse injuries or just trauma injuries because they're playing so many sports. Kids are playing so much. What would you tell a parent who's in therapy, maybe their insurance ran out, they're done with therapy, they have to move on? What would be some recommendations to make sure they get back to a level to be safe and to optimize performance?
Great point, Bill. And I appreciate all the accolades, but the reason why we partner with your team, and particularly you, is that you are cutting edge in this space as well. And I think you realized a long time ago that you've got to get the injured athlete back to performance shape. And I tell all my patients this, but particularly the young patients, that when you're injured, you're here. Mm-hmm. And to perform, you've got to be here.
Yep.
Physical therapy can only take you so far, whether that is the limitations of time, the limitations of insurance. But to get back on the field, you can't be back to where you were before you were injured. You have to be better than you were before. Mm-hmm. And working on balance, proprioception, strength is key, and doing the functional exercise. Mm-hmm. And a lot of times the physical therapist is very skilled in rehabilitation of the injury, but you're looking for someone, a sports performance person, to get you to the next level and get you ready for sports participation. Mm-hmm. So step-down programs, transition programs, very, very important. And I encourage all our athletes, if they want to compete at a high level, they should be doing this. Yep. Just because you got cleared from physical therapy doesn't mean you're ready to go out there and play. I take examples from my other world, taking care of professional athletes. And we have athletic trainers and strength coaches who are dedicated to transitioning that athlete from injury back onto the field.
Yep.
And it is key. Otherwise, what you end up doing is you get hurt, and you're back where you started from, and you miss the rest of the season.
And I know how serious you take this because, we are here at 111 Madison. We have a performance training program right here, right next to your physical therapy department, where we can take athletes right from therapy and bring them along. And you take it so serious. The hospital takes it so serious. They've made a commitment to help athletes get back to not just where they were, but to get them better. And that's what impresses me so much about what you do and Atlantic Health does. They don't just say things, they actually do things. I mean, you look at this building, you look at what you offer, how you run this organization. The sports medicine department is truly, truly cutting edge. And I say that with great pride because it truly is a privilege and an honor to be working with such a great hospital group. I mean, you guys are, managing the New York Jets, you're managing professional athletes, you're managing, athletes of the NJSIAA, and delivering education to these associations, cutting edge education. And with the advent of technology, of imaging machines, there's so much new information coming out. It's sometimes hard to stay up with it all, right? And you guys have done such a great job doing that.
Well, I appreciate that, Bill, and we have, and it's we're dedicated to it. You know, I make a point of every day when I leave the office, I walk down through physical therapy. I see how my patients are doing. I see how the sports performance kids are doing. They need to know that we're involved, that we're dedicated to this, and we want to see them succeed.
Yep, yep. Well, it's great. You know, the takeaway here, guys, if you're in therapy, you definitely need to make sure you continue to not only recover from that previous injury, but to reduce the chances of future injury and to improve performance.
Bill,
Damion, thanks
always
so
a
much.
pleasure.
My pleasure. We'll
Thanks.
see you next time, and always pleasure having you on.
Take care.